Hey family, welcome back to a new episode of Transformed and Renewed. If this is your first time checking us out, make sure you hit that like and subscribe button on your screen. That way you can stay up to date with the latest content that we'll be sharing with you. So let's get into it. So we are going to be talking about diabetes, okay? Now, you've probably heard of this term and you've probably wondered what it meant. And so we're going to talk about that shortly. But before we do that, make sure you hit that like and subscribe button if you're just tuning in. That way you can stay up to date with the content that we will be sharing with you. So when it comes down to diabetes, this is a common disease occurrence that has steadily been trending over the past couple of years. And the data shows that it is not letting up, not for one bit, even when it comes across different ethnicity groups or ethnicities, it is still steady. And so again, we're going to talk about diabetes shortly, and I just want to share some stats with you when it comes to diabetes. So this is based on the National Diabetes Statistics Report 2024, and this mainly comes from the CDC. Now, just looked at this data, and I'm not sure exactly what parameters are used to generate the data, as well as the fine accuracy of it, but it's here, so that's what I'm sharing with you. So it showed that back in 2021, more than 38 million people of all ages, so that was about 11.6%, of the U.S. total population had diabetes, but 8.7 million adults, which was about 23% of the adults with diabetes, were not aware that they had it. So out of the 11.6, we'll just say 12% of adults of all ages who had diabetes, there was about 23% of those individuals who were not even aware that they had it. Now, you can imagine that can be quite, scary, because if you don't know that you have something and you continue with the way that you're doing things, it could get worse, and one day it may not be the same as the day before. And so that is something to keep in mind. And so among those aged 65 years or older, the percentage of adults with diabetes increased 30%, okay? So if you were aged 65 years or older, the percentage of diabetes increased by 30% or 3 in 10, okay? So another stat is that about 352K or 1,000 children and adolescents under the age of 20 years, or it's about 35 per 10K or 10,000 US youth had diagnosed diabetes, okay? So 352,000 children under the ages of 20 had diabetes, okay? And then this includes 304,000 with type 1 diabetes, okay? And then just two more stats, 1.7 million adults aged 20 years or older, or 5.7% of the US adults with diabetes report having type 1 diabetes and using insulin, okay? 3.6 million adults 20 years or older, or 12.3% of all US adults with diagnosed diabetes started using insulin within a year of their diagnosis, okay? So for those who were aware that they had diabetes, they started using insulin within a year, which was about 12.3%. Okay. Now, again, this is based on the National Diabetes Statistics Report 2024. And you can find this on the cdc.gov/diabetes. Okay. So, yeah. So we said that 38 million had diabetes, 8.7% were not aware of it. So let's get into what is diabetes. So when we think of diabetes, this is going to be the occurrence of where you have a disease, okay? So when I think about diabetes, I just think of okay? Which is the same as disease. They both start with DI. But kind of looking further into diabetes, this is where your blood glucose is just too high in your body, okay? That is pretty much as simple as that. So blood glucose, or known as blood sugar, this is pretty much going to be at an elevated level. Now we know that glucose is the body's primary source of energy, so that's a good thing. The thing about diabetes is when your blood sugar tends to be high, and this is where insulin comes into play. When the insulin is not doing its job properly, then you can have elevated levels of blood sugar, and this can cause a cascade of issues in the body. Now, when we talk about type 1 and type 2 diabetes, one thing I want to share is it's not levels. So you have type 1 and then you have type 2. It's not, I'm starting at type 1, and if things get worse, I can advance to type 2. That's not the case. They're both type 1 separate, type 2 separate. Each one means something totally different. But let's start with type 1 diabetes. So type 1 diabetes is going to be where your pancreas basically has beta cells. So these beta cells typically are going to create insulin, which is a hormone. Now, insulin is known for transferring, or I guess facilitating, the blood glucose or blood sugar from your bloodstream into your body cells, okay? Now, when the pancreatic cell or the beta cells are compromised, and in this case, the immune system can attack the beta cells in the pancreas, then you lack insulin, because insulin needs the beta cells in order for the beta cells to make the insulin. So when those cells are attacked, no insulin is being made. When no insulin is being made, you start to have high levels of blood sugar. The way you can look at it is, if you do not have let's say a security guard or somebody that's keeping the premises safe. If you lack a security guard with keeping the premises safe or making sure that things are decent, then you can start to have a lot of suspicious activity, and one activity can lead to another, and now you just have all of this chaos that is erupting. And that is the same case in this instance. When you have a high level or higher levels of blood sugar in the system, this can cause issues, okay? So type 1 diabetes, your insulin is not being made because the beta cells of the pancreas have been attacked, okay? And when we think about this scenario, it's one in which, when we talk about the maintenance, it has fewer options compared to type 2 diabetes. And I'll come back to this shortly. Now, with type 2 diabetes, this is where the body is making insulin, but the body is not utilizing that insulin properly, or it's not enough to still handle the high levels of blood sugar. So the body could still be making insulin, or the beta cells are still generating insulin, which is, still facilitating the blood, or yes, from glucose from your bloodstream to your body cells. But in this instance, again, the body is just not properly utilizing that insulin correctly. And so in both cases, one of the common themes with it is that you could either use an insulin shot, which could typically help your body to get the glucose that it needs to use it as energy. That has been one, but at least with type 2 diabetes, there are, like I said, some additional factors that can play, or some things that you can actually do compared to type 1, which you have limited options. So with type 2, you can actually do several things, such as managing your health. And what I mean by that practically is you could really focus on the types of foods that you're consuming. So in both cases with type 1, type 2 diabetes, one of the things that I know when it comes up, even within the nutrition area, as well as just the medical field, there are different debates, over cholesterol, sugar, saturated fats, etc. But one common thing that I've noticed that has not been, I guess, has kind of been debated in terms of, no, this is wrong, but one that is commonly agreed upon, even amongst those who may disagree on, just any one of those factors, is refined sugars or simple sugars. And that is one that, again, like I said, I've seen to where it is a common denominator, meaning that sugar tends to be just a common denominator when it comes to the typical American diet. And that just means that people have a challenge with not consuming just simple sugars. Now, this can be white flour. So you think about just white bread, crackers, white crackers. You think about just any type of baked goods where it's using just white flour, okay? Even dough, whether you're consuming a pizza, white dough. And the thing about it is, once you consume that, your body is going to break that down into simple sugars because there is no fiber. And so because there is no fiber, it is just straight glucose, essentially carbohydrates. So when there is a lack of fiber in the food, then the body is not going to get rid of that waste easily. It's going to store it. And so you can imagine that in this case, if you're consuming high levels of carbohydrates that lack adequate fiber and can be high in other areas such as salt, just added sugar itself. So you have a simple sugar itself, so the white flour itself. But let's say there's added sugar, so like cane sugar or even high fructose corn syrup. You add that on top of the white flour, and that is just adding to the situation. So you can imagine your body's dealing with a lot, especially if this is a routine occurrence, okay? So you kind of understand where I'm going. So when you have these cascade of events that are occurring, the body is just dealing with this, and you may not feel it just yet. But at a certain point, the body's going to let you know, like, hey, I didn't like the way you've been treating me. Like, I'm not feeling right. And so we have to take this into consideration, consuming a lot of refined sugars, even when those sugars are altered, such as cooking. So when you're baking, when you're frying, this can also change the chemical structure or the physical structure of those sugars and how it is digested in the body. And so, again, that is another topic for another day, because I know that will be pretty long-winded. But again, you kind of get the idea that when it comes down to it, at least when we're focusing on the maintenance part, the managing part, we have to focus on this sugar aspect, understanding, okay, how do I limit refined sugars or simple sugars, and realizing that not all sugars are bad, because you do have simple sugars and then you have complex sugars. Now, your complex tend to be more aligned with whole grains, vegetables, and fruits. And one reason is because they have a complex carbohydrate structure, which means it takes a longer time for the molecules to break down. And so that is one thing I will say, is focusing on those complex sugars more so than refined or simple sugars will be one way. But then another way, at least with type 2 diabetes, is getting some exercise, because the body has been storing fat, especially if you're overweight or obese. You need to start doing some movement. And the reason why I share that is because the only other way, and let's say that you do tighten up on your nutrition, so you start to have a healthier meal plan in place and things are going well, getting the body in movement is can be like a combination piece. And so as you're eating well and exercising, this is helping to essentially kind of speed up as well as complement the work that you're already doing as a result of the nutrition. Now, as we think about diabetes, there are other types. You have pre-diabetes, and this is where a person has higher blood glucose levels, but it's not to the point where they are diagnosed with type 2. Now, however, they tend to be at a higher risk of having actual diabetes, but doesn't necessarily mean that you will get it. It just means that you're at a higher chance if you continue that trend. But, again, following a healthier meal plan or nutrition plan, getting some exercise, reducing stress, this can also play an important role, when it comes down to prevention and maintenance, especially when it comes to diabetes. All right, so before I wrap it up, I have one piece of stats to share with you, and this is the ethnicities that have the diagnosed diabetes, and this was from 2019 to 2021. And so first is American Indian or Alaska Native non-Hispanic at 16%. After that is Black non-Hispanic at 12.5%. Then you have Native Hawaiian or other Pacific Islander at 11.7%. Asian non-Hispanic at 9%. And dead last is Caucasian, 8.5%, which is good. But the way I look at it is any elevation or even just anything greater than 1% is still not good when it comes to diabetes. So we have to do better. And how can you do that? Especially if you're saying, I've been doing my best, trying, and nothing has worked out. Well, you want to make sure you navigate to www.robody.org, to our website. You want to click on that yellow button before you do any scrolling. Make sure you set up your one-to-one health consultation with me, and we can get started on your journey. And so it won't be a matter of saying if this will work or will it work. It would just be a matter of when, okay? And so we're going to do that because, again, this is important to me that we lower these numbers, okay? We lower these stats, especially when it comes to just different ethnicities. And so if you are looking forward to working with me, make sure you navigate to our website at www.robody.org. Set up your consultation with me and we can get started. And before you head out, make sure you hit that like and subscribe button on your screen. That way you can stay in the know on the latest content that we'll share. So if you enjoyed this, again, make sure you support us. And until next time, I will talk with you